Hello, and thank you for joining me. My name is Dr. Matt Williams, and I am a practicing pulmonologist located in Virginia. I would like to share with you today why I chose to treat with TEZSPIRE, tezepelumab-ekko, the first biologic approved as an add-on maintenance treatment for adult and pediatric patients 12 years and older with severe asthma without phenotypic or biomarker limitations. TEZSPIRE is not indicated for the relief of acute bronchospasm or status asthmaticus. It is important to know that TEZSPIRE is contraindicated in patients with a known hypersensitivity to tezepelumab or its excipients. Reactions, rash, allergic conjunctivitis, can occur after administration of TEZSPIRE. These generally occur within hours of administration, but can have a delayed onset. Consider the benefits and risks. We'll cover additional safety information throughout the course of this video. In two pivotal studies enrolling a broad, all-comer patient population, meaning no baseline biomarker level requirements, TEZSPIRE reduced asthma exacerbations by up to 71% in the Pathway study and 56% in the Navigator study compared to placebo. In addition, TEZSPIRE is the only biologic to demonstrate a statistically significant reduction in exacerbations in patients with blood eosinophils from 0 to 300 cells per microliter. Reductions in exacerbations, regardless of phenotypic profile or biomarker level, were observed in patients taking TEZSPIRE. In a post-hoc pooled analysis of Pathway and Navigator, fewer exacerbations were observed in patients receiving TEZSPIRE versus placebo, regardless of baseline blood eosinophil count, fractional exhaled nitric oxide level, or allergic status. Results of this analysis are descriptive only. TEZSPIRE provided a rapid improvement in lung function that lasts. Treatment with TEZSPIRE improved FEV1 by 230 milliliters over baseline at 52 weeks. Moreover, 70% of the lung function improvement was achieved at 2 weeks. Please note, TEZSPIRE is not a rescue medication. Compared to placebo, TEZSPIRE impacted asthma exacerbations leading to ED visits, urgent care, or hospitalizations. TEZSPIRE was shown to reduce these exacerbations by 79% versus placebo. Results of this analysis are descriptive only. Please note, do not abruptly discontinue corticosteroids. Dose reductions, if appropriate, should be gradual and may be associated with withdrawal symptoms and/or unmask previously controlled conditions. Treat patients with pre-existing helminth infections before starting TEZSPIRE. If patients become infected while receiving TEZSPIRE and do not respond to anti-helminth treatment, discontinue TEZSPIRE until infection resolves. Avoid use of live attenuated vaccines. After seeing the TEZSPIRE clinical data, I identified 3 patients in my practice that I was interested in adding on TEZSPIRE because they have been some of my most challenging patients. All 3 patients had a lot in common, including frequent symptoms and exacerbations despite adherence to high-dose ICS/LABA plus additional controller medications, ER visits and hospitalizations as a result of asthma exacerbations, impaired lung function with a percent predicted FEV1 varying between 50 and 70%, frequent bursts of oral steroids, complex phenotypes that include allergic, eosinophilic, and T2 independent components, multiple environmental triggers that can be difficult to avoid, and a reduced ability to take part in the physical and social activities they enjoy due to their severe asthma. What motivated me to add TEZSPIRE to my patient's treatment plan was the unique mechanism of action. TEZSPIRE is the first and only biologic to block thymic stromal lymphopoietin, TSLP, at the top of the inflammatory cascade and reduce the release of downstream mediators that can lead to airway inflammation. This is in response to multiple triggers that can activate the airway epithelium, driving downstream pathways. The mechanism of action in asthma is not fully understood. In addition, TEZSPIRE was studied in a broad, all-comer patient population that included patients with varying levels of various biomarkers at baseline, as well as a history of exacerbations requiring treatment with oral corticosteroids or that resulted in hospitalizations. That was important to me, and it helped me to explain to my patients why I felt adding TEZSPIRE was appropriate for them. I reviewed the various treatment options with my patients, as well as our treatment goals. Together, each of the 3 patients I described made the shared decision to add TEZSPIRE. I explained to each of them that individual results may vary from what was observed in the clinical trials. My patients and I discussed the safety profile information that I stated previously, the potential risks and benefits, and the most common adverse events associated with TEZSPIRE in the clinical trials, which included pharyngitis, joint pain, and back pain. I encouraged each of them to read the patient information available at tezspire.com. Lastly, I explained that they would come into the office every 4 weeks to receive TEZSPIRE by subcutaneous injection. All 3 of my patients were recently started on TEZSPIRE, and thus far they have received 4 doses. While it's still early in their treatment, each individual has reported improved asthma symptom control, and their FEV1 has increased. We are encouraged by the results thus far, and I look forward to monitoring their progress. My early experiences with TEZSPIRE in my more difficult to treat patients has demonstrated to me that TEZSPIRE can be a first-choice add-on maintenance treatment across a spectrum of severe asthma patients, regardless of phenotype. I am excited to have a treatment option that allows me to target severe asthma from the top down at the airway epithelium, which can impact multiple pathways and biomarkers. Thank you for listening to my TEZSPIRE moment. I have just shared how I made the clinical decision to prescribe TEZSPIRE, the first and only biologic approved for severe asthma without phenotypic or biomarker limitations. You can review the full prescribing information for TEZSPIRE, including patient information, at tezspirehcp.com, or you can call 888-TEZSPIRE. That's 888-897-7473.